shows across all the major selling markets in the U.S. and abroad. Call them at 866-224-5422. The AmpSquare.tv library allows productions to be seen over and over again, making commercial platforms more usable. Call 866-224-5422. Toll free 866-224-5422. AMP2.tv, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.tv. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to Concierge Men's Health. It's a show we have tonight here, sponsored by All County Healthcare, a Medicare certified agency. You can hear All County Healthcare show here on every Tuesday, 6 to 7 p.m., and also here at 5:30 p.m. on Fridays. If you missed any of the broadcasts, it will air again on 95.3 FM. And then also on 1470 AM and on the All County Healthcare Facebook page, probably the easiest place to find it right there, and on their website as well. If you have any healthcare questions, please call 954-717-7027 and ask for Maddie. She will be happy to answer all of your questions. So without further ado, I'm really excited to have on the show tonight Dr. Sarab Sanan. He is a structural heart disease and interventional cardiologist with Tenet Florida Cardiovascular Care and the medical director of the Structural Heart Therapies program at Palm Beach Gardens Medical Center. Hey, I was born there at Palm Beach Gardens Medical Center, so we can kind of connect on that. Dr. Sanan, welcome to the program. How are you doing tonight?
Doing great, David. Thanks for having me.
And thanks for coming aboard on this first edition of the Concierge Men's Health with me as the host. So I'm really happy to have you. Let's get right into it. What is structural heart disease?
So structural heart disease is a field of interventional cardiology that deals with taking care of and treating diseases and problems with the cardiac valves or walls of the heart or other defects in the heart in a minimally invasive surgical fashion. So instead of opening the chest up with a sternotomy, all of these procedures are now able to be done via small micro-incisions in the groin, in some cases through the wrist.
That's amazing. Now it's a small incision where they used to, like you said, open up the chest. They used to have to actually open it up and cut through actual, is that breastbone or rib bone?
The sternum, which is a breastbone.
Oh, wow, sternum, yeah. So now you're going in minimally invasively. And you mentioned you go through the wrist and is it the groin as well?
Mostly it's from the groin, but in very select procedures, we can even go in from the wrist and do some of these procedures.
Okay, staying on structural heart disease, since we were talking a little bit about that, are there signs and symptoms of valvular heart disease? Because I'm always thinking, I'm not, everyone knows I'm kind of a bigger guy, kind of the size of NFL lineman. Every once in a while, you get a pain in your arm, it goes away, or maybe a little stiffness. Is that something that, you should be seeing a cardiologist about? Is that a sign and symptom of actually something?
I think if you have any of those symptoms, you should definitely seek medical attention. In most cases, structural heart disease may be manifested by valvular heart problems. So valves in the heart can be leaking or they can be narrowed. And when patients have those sort of problems, they usually present with shortness of breath. They may have chest pain or chest pressure, but shortness of breath is the common presenting symptom in these cases. They could also have other symptoms of heart failure, such as swelling in the ankles or difficulty breathing. So if you are experiencing any of those symptoms, you should definitely seek medical attention.
That's good enough. So you can see a primary care, you can go to your emergency room, or even you can go to a cardiologist.
You could, yes.
What's the difference between a traditional cardiologist that we know about and an interventional cardiologist like yourself?
So traditional cardiologists take care of cardiac problems with medications.
Okay.
Interventional cardiologists can go a step further and open up blockages in the heart if they are present. And then you have structural interventional cardiologists like myself, and we are able to open blockages in the heart and such as well. But in addition, we can also fix problems with heart valves, with holes in the heart, and a lot of the cardiac surgical things which can now be treated with minimally invasive techniques rather than open heart surgery.
That's amazing where this is going with the heart and in cardiology and the brain and neurology and just all of medicine lately. I mean, it's really moving fast.
It's a very rapidly evolving field, and there has been tremendous progress over the last few years.
And we were talking briefly before you went on that structural heart disease hasn't been something at the forefront of, let's say, like something like a common thing, like a cardiologist or a common medical title. Is that something that's came in the last decade or so?
Because the field is so new,
that's what I was trying to say.
the title is also new. And so most of the technologies that I use to treat these conditions have been FDA approved in the last 2 to 5 years. They've been around a little longer in research stages, but commercially available over the last 2 to 5 years. So it's a very new field, but with a lot of strong data to support the kind of procedures that we can offer our patients.
And your area of expertise is within structural heart disease and more specifically mitral valve disease. I know this past week you had a really unique procedure, something I haven't even heard anyone else in the area doing with mitral valve disease. Can you tell us about that?
Sure. So the mitral valve has been my area of interest for quite some time now. And this particular patient that you mentioned actually came in from out of town. He is an older gentleman who has had his mitral valve replaced twice already. And as you know, each time you have a valve replacement done, your risk for a subsequent valve surgery or any cardiac surgery increases exponentially. So this gentleman had his mitral valve replaced twice and now had developed breakdown of his cardiac tissue around the surgical valve. So he was leaking blood from around a surgically placed mitral valve. And as you can imagine, going back in for the third time in an old person to replace the valve for a third time is a very high-risk proposition. And so this patient heard about me and came down, and I was actually able to go in from his groin through a vein and put small plugs into that area of the heart which had tissue breakdown to seal up that breakdown and essentially stop the leakage. He was in the hospital only for 2 to 3 days, and he's back and feeling great. He tells me he's a new man now.
Well, listeners can't see, but the viewers can. I'm shaking my head because I can't believe, that is going on in medicine today. And so let me get this right. So the connective tissue around the heart, it was already repaired with a heart valve, but over time it had started to leak, and that caused obviously a huge issue with this patient. And you come in and repair that leak of the heart valve that's been replaced.
Yes. So the condition is called paravalvular leak. So it's a leak around a surgically placed valve. It could be the mitral valve or the aortic valve, could be different valves. But once you have that leak, the problem is then through the leakage, the patient then starts developing breakdown of his blood cells. A lot of these patients require blood transfusions as a result of that breakdown of blood cells, and a lot of them develop heart failure. So this is a problem which has a lot of symptomatic impact on the patient's life, and it is something that is easily treated by people who are trained in treating these conditions.
Is this paravalvular leak closure something new to this area in South Florida? Because I've never heard of it before.
The procedure has been around for a while, but very few operators are actually skilled enough to do it. And so I would say there's not too many people that do it around here.
Okay. And so I also hear you train physicians on in across the U.S. and internationally on a procedure called TAVR. Now, I've heard TAVR in the news a lot. It's an acronym. I kind of know what it stands for, but I have no idea what it means. Can you explain first TAVR and then how you are able to work with physicians interested in providing this type of care?
Absolutely. So TAVR stands for transcatheter aortic valve replacement. So it's a minimally invasive type of replacement of the aortic valve in which we can go in from an artery in the leg and replace the patient's narrowed aortic valve instead of doing open heart surgery. This procedure has been around since 2002 in Europe, around 2005 in the US, and it is one of the procedures that I have a lot of expertise in, and consequently, as new TAVR sites open up and as surgeons and physicians need help or expertise doing complex cases, I'm always happy to help them at different sites around the country and around the world to show them how this procedure is done.
And last time you were on this show, actually, I keep on saying this show, so we're on Concierge Men's Health, but last time you were on the Tuesday night show, you and your doctor, which is also sponsored by All County Healthcare, a patient from Canada saw the show and called your office interested in how you could help with them, and actually did it turn into a TAVR case?
I'm actually scheduled to see the patient soon. He will be here, and hopefully we can help this person out.
Wow, and they're from Canada. Like, they heard this show either online or iHeartRadio app or however from Canada. Wow, that's amazing. So we're definitely get the word out on some great healthcare treatments across South Florida and beyond. I wanted to ask you, where do you perform this TAVR procedure?
So I perform my procedures at both Palm Beach Gardens Medical Center and Delray Medical Center. Both are really good sites with a lot of great technology and all the equipment and expertise we need to perform these kind of complex procedures.
And tell us again, when does someone need a TAVR? This is with the aortic valve of the heart?
Right. So the TAVR is needed in patients who have narrowing of the aortic valve. It's called aortic stenosis. And when patients have these narrowed valves, and if the patient is at medium or high risk for conventional aortic valve replacement, which is surgical aortic valve replacement, then those patients qualify for this procedure called TAVR.
And what is the normal recovery time of a TAVR procedure?
Typically, patients will be in the hospital for 2 to 3 days, sometimes shorter than that, and are then able to go home and lead a very normal and hopefully better than their previous state of health life.
And then lastly with the TAVR, so they used to do this procedure, they'd have to cut the sternum, and now you're telling me that you're going through the groin interventionally. So I know interventional cardiology is catheter-based treatment of cardiac ailments. Mm-hmm. So that's what's going on here. You don't cut any skin or tissue. You're just going in through actual veins or arteries?
Absolutely. So
wow.
we don't need to open the sternum up or the breastbone to get in to the heart to replace the valve. We can now go in from arteries in the leg. In some cases, we can go in from a vein in the leg as well. That's called transcaval TAVR. It's a very specialized type of TAVR, and that's also available. But in most cases, we're able to do these procedures without having to open the chest up to deploy the valve.
Unbelievable. I want to take a quick break. I'm just going to give out your info really quick, and then we'll take a quick break and talk about the Mitra clip, which I really want to get into. So we're here with Dr. Saurabh Sanin, structural heart disease and interventional cardiology at Tenet Florida Cardiovascular Care. He's also the medical director of the structural heart therapies program at Palm Beach Gardens Medical Center. Phone number of Dr. Sanin's office is 561-425-9881. And he's located in Palm Beach Gardens, 3370 Burns Road, Suite 103, Palm Beach Gardens. But he's also on staff at Delray Medical Center, which, as you know, is right around the corner from this show. We'll be right back on the Concierge Men's Health Show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to the program, Concierge Men's Health, but we're talking about men's and women's health as well, and of course the heart. I got my blue heart there. So welcome back. This is a show sponsored by All County Healthcare, a Medicare certified agency. You can hear their show every Tuesday from 6 to 7 p.m. on 95.3 FM, 1470 a.m., or right now every Friday, 5:30 to 6, right here. If you have any questions, healthcare questions, you can call 954-717-7027. Ask for Maddie. She will be happy to answer all your questions, or check out their Facebook page or website where they have the shows. And if you want to call in, we only have a few more minutes with Dr. Sanin, structural heart disease specialist. But you can call in 1-888-565-1470 if you have any structural heart disease or TAVR questions as well. Continuing on the topic of TAVR, this is a whole other thing you're doing in TAVR is a MitraClip, and I've seen this in the news, but again, it's something I glanced over because it looked like something I wouldn't understand. I waited till this moment to have a doctor on to explain it. So do you do this new procedure, MitraClip?
I do, and this is a procedure that is meant for patients who have leaking mitral valves. Mitral valve is one of the four main valves inside the heart, and that separates the left upper chamber from the left lower chamber of the heart. In a normal heart, this valve acts like a door, and it lets blood in from one chamber to the other, but does not let the blood leak back. But patients who have mitral regurgitation or leaky mitral valve, those patients have leakage of blood from the lower chamber up to the upper chamber of the heart, and that leads to heart failure. And so this is a therapy that allows us to stop that leakage by deploying a small clip on the valve, which cinches the two leaflets together and prevents the leakage from happening. Again, like most other procedures I do, this is a minimally invasive procedure. Patients stay in the hospital typically for a day, at the most 2 days or so, and are able to feel much better very soon with this. There's no sternotomy or surgical incision needed in the chest.
I keep on shaking my head, and the viewers can see because I can't believe that this is going on. You can walk out of the hospital 2 days after having what used to be an open heart surgery.
Yeah, it's a fantastic procedure, and patients feel a world of a difference after this.
Wow. Now, you also do valve-in-valve implementation, and this is something else, implantation, I should say, that you're also training doctors and surgeons on as well?
That is true, and so this is something which we started doing over the last 5 years as the FDA approved this technology. And basically what it is some patients have surgical valves. These are bioprosthetic surgical valves. They could be in the aortic location, in the mitral location, in different locations in the heart. But what happens is over time, a period of years, these valves can deteriorate. These are surgical valves. They are placed by a surgeon. And then as the patient ages, those valves can stop functioning normally, malfunction. And so now there's an option where we can go in from an artery or a vein in the leg and put a new valve inside of this old valve without having to open the chest up. So that is called valve-in-valve implantation. It's FDA approved, and again, it's a very low footprint procedure, allows the patient to recover very fast and be home feeling good really soon after the procedure.
Amazing. And I do know a little bit about the next topic, the Watchman device, and correct me if I'm wrong, but this watches over any blood clot moving through the system that could kind of pop through the heart and cause a stroke or even worse.
Absolutely. And so this is a device meant for patients with atrial fibrillation or irregular heart rhythm. And as we know, patients who have irregular heart rhythm are at risk of having a stroke. And to prevent a stroke, your doctor might start you on a blood thinner or anticoagulation. So that could be warfarin or it could be one of the other blood thinners. The problem with blood thinners is that although it will prevent the patient against a stroke, it also predisposes the patient for a bleed. So if a patient on a blood thinner has a fall, there could be a major bleed event. Or if the patient who's on a blood thinner has poor balance, the person could fall and have a bleeding event. Some patients have a bleeding tendency to start with and they cannot tolerate blood thinners. So these are the kind of patients that we can offer the Watchman device. It's a little device, it looks like a little jellyfish, and we can thread it in from a vein in the leg into that chamber of the heart where blood clots develop. And so then it seals off that chamber from the rest of the heart, and the patients can come off of blood thinning within a few weeks. So it's a very nice option for patients who would like to come off of blood thinning because they have a risk of bleeding or risk of falls.
I know everyone's driving around or listening and thinking about loved ones or their self and probably wondering, is Dr. Sanin board certified? Nowadays, it's something we look for right away. I'm on Dr. Sanin's website, tfcc.tfpsheart.com. Dr. Sanin is board certified in interventional cardiology, cardiovascular diseases, internal medicine, and nuclear cardiology. Wow, 4 different board certifications. You don't see that every day. And so I just wanted to mention that because I think that as the common people, someone who's not really trained medically, we're always looking for the board certifications. So there you go. So we talked about TAVR. You've been great explaining what that is. We've talked as well about the MitraClip, the Watchman device, and paravalvular leak closures. Are there any other leak closures that you do? I see area of interest in ASD/PFO closures. Is that something similar to the leak closure?
Yes, it's somewhat similar. So just to explain to our audience, ASDs or PFOs are medical terms for holes in the heart. And these holes are generally between the 2 upper chambers of the heart. And in some cases, it's congenital. And if you really look at it, 20 to 25% of people, not even patients, just people who don't have any problems may have a PFO. Now, so just because someone has this hole in the heart does not mean it needs to be closed. But in certain cases, when patients have this PFO or this hole in the heart and they have a stroke, then those patients are theoretically at a higher risk of stroke again because of a blood clot which may theoretically cross this hole through the heart and go into the brain. So those are the kind of patients where considering closing this hole with different types of plugs becomes a very reasonable option, and that is something that I offer my patients. We work together with a neurologist as we evaluate patients to close these type of defects. And as a team, we make this decision and we can offer this to patients who are candidates for it.
And that's a neurologist, not a cardiologist.
It's a neurologist.
Oh, wow.
And as you will look in this field of medicine around you, you'll see this concept of teams. You have a heart team in which we work with cardiac surgeons to determine which patients require transcatheter procedures versus open heart procedures. For ASDs and PFOs, we work together with neurologists. That's a heart-brain team. And as a team, we evaluate every patient and determine who might be the best suited for which kind of therapy. So it's double the benefit for the patients because you have multiple specialists looking at the same patient from different aspects.
That's amazing. Great team approach. And those ASD PFO closures, are those holes in the heart caused by, say, a congenital condition, something that someone was born with, or is that something that develops over time as the heart grows and anything else could happen to it?
In most cases, these are congenital defects, and in most cases, it's not even a pathology. So it's not a disease just because of its presence. It becomes a problem when patients have either blood clots in association with these sort of defects, or if they've had prior strokes. There's a different type of heart defect called a VSD, and that's almost always related to a disease process and not normal.
Well, Dr. Sandin, we've covered a lot. We have a couple more minutes. I want to ask a little bit about stent procedures, because that's how I first found out about interventional cardiology. My father had a stent, and I met the interventional cardiologist. So you do complex coronary interventions or stent procedures as well?
I also do those. These are essentially procedures which help us to relieve blockages in the arteries of the heart. Patients who have blockages may have chest pain or chest tightness or shortness of breath, or may have had positive stress tests or abnormal stress tests. And in these cases, sometimes patients have one or more blockages, and there are stent options for these blockages. I perform most of my stent procedures through the wrist, and that allows the patients to be up and about and walking soon after the procedure, and allow the patient to go home even the same day. So there are a number of new options for patients who have blockages in the heart as well.
Well, if you have any questions, you can check out Dr. Sandin's website at tfcc.tfpsheart.com. That's Tenet Florida Cardiovascular Care, 561-425-9881. Dr. Sandin, thank you so much for taking the time to explain TAVR to us and paravalvular leak closures and everything about interventional cardiology in 30 minutes.
Interventional cardiology in a nutshell,
Yeah,
right there.
That's perfect. Thank you, and look forward to having you on again.
Thank you for having me, David. Pleasure.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and